You work with the rural veteran community. What unique mental health challenges do rural male veterans experience that others may not know or think about?
So rural veterans are 20% more likely to die by suicide than their urban counterparts. Rural areas often lack specialized services, resulting in a 70% lower likelihood of receiving mental health treatment compared to urban veterans. And again, they just kind of have that fix it yourself culture combined with that geographic isolation. And of course, that can all be worsened with depression and PTSD symptoms. And then there's sometimes there's that advantage of having that small, tight knit community in these small rural areas, but that can also lead to that fix it yourself culture and are more likely to have stigma, associated with mental health treatment and less likely to seek help. Kind of long-standing culture with typically older folks, and veterans do typically be of a older age than the non-veteran population.
Sharing that you need help can be hard for some men and women too. How can people who care about male veterans in their life open the door to start the conversation about mental health, suicide, and help seeking?
Someone doesn't have to be a licensed therapist. They don't have to be a clinician or in any kind of academic field to talk about suicide. And so that conversation can just start with, hey man, or what's going on, or are you okay? Just because it's simple doesn't mean it's not effective. You just have to get the conversation started. It's better to maybe go into that conversation a little awkward than not go into it at all. And then when you start that conversation, just be sure to let them talk and just be sure that you listen more than you speak. That's another key component. And then also just let them decide how much to share. You don't want to push too hard, but just give them that space. And once they start feeling comfortable, they will typically open up and share what they want to share. But at the same time, don't be afraid to be direct. You want to keep it simple, keep it kind of light. It's starting that conversation, but it's also okay you have to be direct. And so it may seem uncomfortable, but those of us that have had some mental health first aid training or SAVE training through the VA or QPR, all of those proven programs tell us that it's okay to ask directly, are you thinking about suicide? Are you thinking about killing yourself? And that may seem really odd for some folks, like, wow, you just come right out and ask that. And that's okay. That's what we're supposed to do, to be that direct. And of course, if they answer yes, you want to take proper steps at that point. There's a 988 crisis hotline. And if you dial that number and then press 1, that takes you directly to the Veterans Crisis line. And then you could do that for them. You could ask them if we could call together. So you don't want to just leave them there with that number. Just make sure that they make that connection. Kind of going back to that conversation, it's fine to let them know also that you may not know exactly what they're going through, and you understand that, that you don't try to compare your own situation with theirs because everyone's is unique. So just let them know that I may not be able to completely understand what you're going through. Everybody's situation is unique, but I'm here for you. We can talk this through. Let's see what we can do about this.
And therapy can be a great starting point for men to check in with how they are doing and feeling. When you have shared man therapy with male veterans, what have they liked most about it?
It's that they use that humor and no-nonsense, non-clinical approach. That's more resonates better with the typical veteran, especially male veteran. They just like that direct, sometimes dark humor is usually kind of the culture of the military. And then, of course, veterans just like that 20, I've noticed they like that 20-point head inspection. That's kind of the first process in the man therapy program. They can just kind of do that from the comfort of their home and kind of get an idea of where they're at just by simply doing that. And it kind of frames mental health care as a strength instead of a weakness. And that kind of relates to that warrior identity.